To our webinar series, Clearing the Fog, Understanding Brain Fog During Menopause. And we have our expert speaker, Dr. Caroline Gurvich here. Before moving on, just briefly, I would like to tell you about Miyara. We are a women's health platform for women in midlife. We simplify your life through a few different ways. One is education and awareness. We do it for both corporates and communities. We have symptom management programs and well-being programs. We provide access to nutrition, fitness experts, and psychologists. And you can be part of a private group with similar issues that others have. So we have a lot of, we have a WhatsApp community, we have Facebook community. We are on all social media where you can get information about us. And diving straight into today's presentation. Thanks a lot, Dr. Caroline Gurvich, for joining us today and talking about a very important topic, a very relatable topic. So the reason we're having this conversation today is we have got these questions about why can't I remember two things at the same time? What is happening during my menopause? Why are things changing? What can I do about it? How can I help with this brain fog? What is the science behind brain fog? We had all these questions from people who registered today. And these are exactly the questions that Dr. Caroline is going to be answering. She's a clinical neuropsychologist, an associate professor at Monash University, and the deputy director of the Hair Center Australia at Monash University. And she is very passionate about women's health, mental health for women, the cognition abilities and how it changes for women as they grow older. And she has done a lot of work in this space. So welcome, Dr. Caroline.
Yeah, thank you very much, Gayatri, for inviting me to present today. I appreciate it. And just confirming you can see my screen okay that I've shared. Excellent. All right, so I'm going to talk today about these different topics. So I'm going to talk about cognition or brain fog and whether cognition changes during menopause and how common that is, what the impacts of these cognitive changes are. A common question is, how can I tell if this is brain fog or is it something else? What causes cognitive changes? So what does the science tell us so far? And probably most importantly for people, what can I do about it? So just so we're all on the same page, we're talking today about menopause, which is a natural phase of life. And we don't want to medicalize something that is natural and everyone goes through, and some people glide through and some people struggle through. But it's a natural phase of life that can happen generally sometime between the ages of 45 and 55, where there's a loss of ovarian follicles and follicular development, hormone production. And because of those, there are quite significant changes in our hormones. So I'm going to show you this slide here, which has got lots of different hormones on it, or the key ones. So just in terms of the colors, the most important hormone is estrogen, and that's the orangey brown color. And during our reproductive phase of life, that cycles across the menstrual cycle, as does progesterone. And then there's luteinizing hormone and follicle stimulating hormone, and they fluctuate quite regularly for most people across the menstrual cycle. But then some people go through pregnancy and there's big hormone changes in the pregnancy and postpartum period. But then the period that we're focusing on is the menopause transition. And what you can see is that there's this period called perimenopause, which is the lead up to menopause. And during that time, while our estrogen, and particularly a type of estrogen called estradiol, is gradually declining, it does so in this fluctuating way. And it's thought that it's these rapid fluctuations that are really important in terms of what happens to our brain. And I'm going to come back to this slide and talk more about why it's relevant, but I just wanted to give you this overview of what's happening to our hormones over that menopause transition or perimenopausal years until the time that we hit menopause. So menopause is defined as 12 months following that final menstrual period. And there's not really any clear blood test you can do for perimenopause. There are lots of symptoms and indications about when someone is in perimenopause, but because there's the fluctuations in hormones, it's hard for a blood test at a single point in time to say, oh, you're perimenopausal. So it's a 4 to 10 year on average period of these hormone changes before that final 12 months after that final menstrual period, which is when someone achieves menopause. So we're talking in today's talk, when we're talking about the cognitive changes, we're talking about that whole perimenopausal and very early postmenopausal period where people tend to notice these cognitive changes. So that sort of time frame. So when we talk about cognitive changes or brain fog or the fog of menopause, this, as far as I understand, and most people who I speak to understand, this really was not spoken about until about 5 to 10 years ago. No one spoke about it. But now it seems to be much more spoken about, both in the media and in the scientific literature. In terms of the scientific literature, this idea of menopausal brain fog was only defined 2 years ago. So that's how new the concept is. Even though the experience of brain fog during menopause is not new, the discussions about it and the definition and the science is really just evolving now. So the literature defines menopausal brain fog as the constellation of cognitive symptoms experienced by women around the menopause, which most frequently manifest in memory and attention difficulties and involve such symptoms as difficulty in coding and recalling words, names, stories, or numbers, difficulty maintaining a train of thought, distractibility, forgetting intentions, so that's walking into a room and forgetting why you walked into that room, and difficulty switching between tasks. So while I didn't publish this paper with this definition, it was published by Pauline Mackey, who's a big researcher in this field. It really closely mirrors the types of experiences that women I see talk about, all of these exact symptoms. So in terms of other research and brain fog and what other research has represented, this study was done with 12,000 women. And I think this was a Japanese study, and they were nurses. And this shows that while we all experience forgetfulness day to day, it happens to everyone, male, female, whatever someone's gender is, at all different phases of life. What this shows is that prevalence of that poor memory or forgetfulness really does peak in the years that coincide with menopause, both slight memory and forgetfulness as well as more severe. So this study wasn't about menopause, but it just shows that that's when the peak is. So it's something that everyone experiences, but for some reason, which we'll talk about, it peaks during the perimenopausal years. In our own research, we use a questionnaire called the Everyday Memory Questionnaire, and we've validated this in perimenopause, and it's a self-report scale. It's just 13 items, but it's really good because it gives a measure of attention and it gives a measure of everyday memory, and it aligns with the types of brain foggy type symptoms that women report. And the most common symptoms that we found, and in the perimenopausal group, which is that orange group, so that's the group of women who are in that lead up to 12 months after the final menstrual period or lead up to menopause, people found an increase in that tip of the tongue phenomena that we all experience from time to time, but it's really prevalent during perimenopausal years, that people just have trouble retrieving words. And this was happening for some women, 40% of the women in our study, once or more per day. And sometimes it can be subtle and sometimes it can be really impactful and frustrating for people. And the other really common symptom in a third of women happening once or more per day was having to check whether you've done something that you should have done. So just not trusting your memory. So I just wanted to spend a bit of time from a neuropsychological perspective, just talking about what happens, what are the processes involved when we use our everyday memory. It's not just one thing. It's not just memory per se. So the whole process of taking in information and then later remembering or retrieving that information, it starts with us being in our environment, and we're constantly bombarded with lots of sensory inputs. And for humans, it's mostly what we hear and what we see are the dominant senses. And we also have internal thoughts. And sometimes when you're stressed or anxious, those internal thoughts take up a lot of our space. But the first thing we have to do when we want to learn a new piece of information is focus our attention. And sometimes this is where the problem is. So even though it feels like a memory problem, it's that we just weren't focusing our attention. We might have been reading something or taking part in a conversation or a meeting at work, but we were focusing on our internal thoughts or our rumbling stomach because we were hungry or a different sense. So sometimes we don't take information in because our attention is not focused. We're not shining our light or shining our attention on the right piece of information. Once we do that correctly and we focus our attention, there's a few more steps before we learn a new piece of information. So it might be, because we talked before about forgetting why you walked into a room. Sometimes your attention is there, you know why you want to walk into a room, but then you get distracted. And sometimes that's our working memory. So that's when we have to hold a piece of information in our mind and work with it, like I'm going to go into the kitchen and get a mug. And you just hold that briefly. And then if you get distracted, sometimes that thought is gone and it's really hard to get that back because we haven't maintained it and worked with that thought for long enough. If it's something that we really need to encode and recall later, so for example, in a work context where we might be needing to absorb a piece of information and then retrieve it later, we have to encode that information. So we have to attend and hold it and work with that and then encode it. And the actual storing of information is a chemical reaction within our brain. And then later in time, we have to retrieve the information. So it might be, again, in a work context, retrieving something that you've read earlier or something you wanted to share in a meeting, and we have to try and remember what that information is. And sometimes in everyday life, we feel like our memory is failing us, but it's just important to know that there's all these steps involved in taking in new information. And sometimes while it feels like a memory problem, more often than not, in the case of menopause, it's not that we're failing to learn new information and form a new memory. It's that we're failing to really focus and encode that piece of information, or we get a bit stressed and we have trouble retrieving the information, but it has been encoded. So that it's the two ends of the everyday memory steps that seem to be most impaired in the context of menopause. So I'll come back to this again in a moment. So the impact of this brain fog or cognitive changes during menopause, for some people, it's really subtle and it doesn't have an impact in day-to-day life. But this study showed that in 50% of women who were menopausal, poor concentration and poor memory were problematic for them at work, and close to a third or more than a third also found it problematic for life in general. So this suggests that for some people, or a large chunk of women, it's not subtle. And there are other studies that have shown that over 3/4 of women with menopause symptoms report lower work ability. And this is an Australian figure, but it's really interesting that they estimate, the Australian Institute of Superannuation Trustees, it's estimated that the cost of menopause is more than $112 billion. And they've come to this figure because a lot of women leave work during menopause because they're struggling or drop down to part-time work, and then they lose their income and they lose their superannuation. And so this just shows the economic impact of menopause, but reflects some of the underlying symptoms that mean that women leave work because they feel like they're not coping. So the cognitive symptoms, the brain fog type symptoms, while they might be subtle or not hugely significant in terms of the cognitive changes, they can really impact women in terms of their self-esteem, particularly when women don't relate it to menopause. So they just suddenly feel like they're not up to it, and it can really impact self-esteem. Sometimes this can then further exacerbate difficulties absorbing information, either when you're reading something or in conversation, because you get anxious about your cognitive ability. This can lead to procrastination. You don't want to start things because they're hard, or you're worried you won't do so well, and you take longer to complete tasks, and you avoid tasks or avoid making decisions. So those sorts of things can then have a flow-on impact to work, to hobbies, to relationships, to the benefits of different therapies that you might try to engage in. So it's the full spectrum from brain fog, from no impact or no experience of brain fog. About 60% of women do experience brain fog, and within that 60%, a chunk of women do have quite significant impacts because of their brain fog. So clinically, I often have the question asked about, is this brain fog or maybe it's something else? And the key something else's that I get is, I think I have dementia, or I think this is long COVID, or I think I have ADHD. They're probably the most common clinical comparisons or clinical concerns that people have during the perimenopausal years when people are experiencing problems with their cognition or brain fog. So just to address each one of these, the first one is this Alzheimer's disease. So Alzheimer's disease, just for those who aren't aware, is the most common cause of dementia, but it's a progressive neurodegenerative or neurological condition. Menopause is not progressive in the same way. The typical age of onset for Alzheimer's disease is 65, and then that risk keeps increasing with increasing age. So this is about 10 to 15 years older than the average age of menopause. The symptoms of Alzheimer's at the very mild stages have some resemblance to brain fog symptoms, so repeating questions or being forgetful. But some of the other symptoms, like getting lost in a familiar environment, wandering off, difficulty recognizing people you know well, impulsive type behaviors, difficulties, really significant difficulties communicating, they are not symptoms that we generally see as a part of that perimenopausal brain fog. So it's often quite easy to tease apart whether it's Alzheimer's or early stage Alzheimer's or the more subtle brain fog type symptoms. The other important distinction is that for Alzheimer's disease, if I assess someone as a clinical neuropsychologist, I will see quite clear cognitive impairments, and in particular, often the primary deficit is a memory deficit where people cannot learn new information. Whereas in menopause, when you assess someone in a clinical structured environment, the cognitive neuropsychological profile is generally within the normal range. So even for people who are having quite significant day-to-day difficulties, their neuropsychological performance is generally not significantly impaired. So the core cognitive skills of memory, for example, are intact if someone is able to focus and pay attention to the task. There is one bigger question that I like to address about whether there might still be a link between menopausal brain fog, and Alzheimer's disease, because females do have a greater lifetime risk for Alzheimer's disease. We know from the literature that women who have early surgical menopause, so have both of their ovaries removed, an oophorectomy prior to the age of natural menopause, have got a higher risk of dementia and cognitive decline. So there is some sort of link that's there in the literature. And we also know that menopause is a dynamic neurological transition. So it's not neurodegenerative, but the brain does change. There are neuroimaging studies that do show changes in the brain. So if there is this potential link, and there's no evidence really that there is, but I wanted to highlight it because while menopause might possibly be a time of vulnerability to later life things, it's also a time that we can really seize the opportunity to build our cognitive health and take this time to maximize our brain health. And so I'll come back to how to do that at the end of this talk. So the next common question I have is this long COVID, if someone's had COVID, or is this menopause? And again, there is a higher prevalence of long COVID in females than males. And this is thought, again, to be related to changes in estrogen hormones and estrogen having some sort of role in this. There's an overlap in symptoms between long COVID and menopausal brain fog. So brain fog is a symptom of long COVID. Fatigue, reduced stamina, poor sleep, muscle pain, depression. Those symptoms could be due to either long COVID or menopause. So I think the take-home message is for anyone who's had COVID and been exposed to the virus and has developed ongoing symptoms, just think about if you're female, think about maybe this could be menopause, and maybe menopausal hormone therapy might be helpful, or menopause treatments might be helpful. So something to discuss with your general practitioner or health practitioner is, just to think about menopause, because sometimes people don't think about menopause and they just attribute everything to long COVID. So it's good to think that, oh, hang on, maybe this could be related to menopause. So the final one is ADHD and menopause. So this has come up more recently for me and clinically. So just to touch on what ADHD is, attention deficit hyperactivity disorder. It's a neurotype. So it's a different way of thinking that's characterized by inattention as well as, or instead of, hyperactivity and impulsiveness. So ADHD is neurodevelopmental. So this means the onset of the ADHD symptoms is not during menopause. So if the first time someone experiences these symptoms is during menopause, it's likely to be brain fog. But some women report that in menopause, it really kind of uncovers something that's always been there, or there's a worsening of symptoms that have always been there at a more subtle level. So it is something to consider, and there is some degree of overlap in terms of women who are perimenopausal reporting difficulties with organization, working memory, focus, and attention, which can be symptoms of ADHD as well. So again, this overlap is something to think about. And we don't really know where the menopause is because of the hormone changes and links between the neurochemicals involved in ADHD and those involved in that are related to the hormone estrogen. We don't know whether they might be related in some way, or an uncovering might happen at menopause. So what causes the cognitive changes or the brain fog that people experience during menopause? So I just wanted to talk very briefly about how does cognition work in our brain, and this will become, the next slide will explain why this slide is relevant. So I just wanted to very briefly give a very oversimplified view of how we think in relation to how our brain works. So the two key brain areas I wanted to point out is the temporal lobe, which is the green lobe at the bottom of our brain, or not quite the bottom. And the temporal lobe houses an area of our brain called the hippocampus, which is really important for memory. And it also houses the amygdala, which is a part of our brain that's really important for our emotional control. The other part of the brain I wanted to highlight is the front part called our frontal lobe. And our frontal lobes house what we call our executive functions. So our executive functions are a little bit like the CEO of our brain. They're the part of our brain that bosses around or organizes the rest of our brain functions. So our executive functions choose where our attention is directed to. They help us make judgments, solve problems, inhibit or stop ourselves from doing silly things or impulsive things. They help us with decision making, and they really are our home of our behavior and what defines our personality. So that's the executive functions in the front, and then in the temporal lobe, the memory and the emotion. So just keep those blue and green bits in mind for a moment. And then if you remember back to this slide, which shows what's happening to our hormones, and that around the time of that perimenopausal years, which can span sort of 4 to 10 years in terms of the perimenopause, we have these rapid and declining fluctuations in our estrogen, and also a slow decline in progesterone. So just keep those two things in mind. So this period here. Now, if we come back to these quite sciencey pictures of the brain, I just wanted to show you again the blue part, which is the frontal lobes and the home of our executive function, and the green part, which is our temporal lobes and where our emotions and our memories are housed. The reason I'm showing you this is because there are tiny little dark red triangles and dark blue circles, and the red triangles are at estrogen receptors. So these are parts of our brain that respond to estrogen. So estrogen, while it's in our bodies, it also crosses our blood-brain barrier and goes into our brain, as does progesterone. And you will see that these are quite densely located in the front of our brain, which is where our executive functions sit, and in the temporal lobe, which is where our hippocampus and our amygdala sits. So from a scientific perspective, it makes sense that if our brain is used to being stimulated by these hormones, estrogen in particular, and suddenly it's being stimulated, then it's not, and then it is, and then it's not, and it's fluctuating and gradually declining, we might experience changes in the symptoms that relate to these particular brain areas. The other reason I'm showing you this particular slide is because it also shows that estrogen and progesterone interact with other neurochemical pathways in the brain. So you might have heard of dopamine. So dopamine is a neurochemical that's really important for motivation and gratification. And it's also implicated in things like ADHD. And when estrogen and progesterone fluctuate, we can also, they modulate or change the dopamine pathways. They also change the serotonin pathways. So you might have heard of serotonin. That's a neurotransmitter or a chemical in the brain that's really important for regulating our mood. Then there's the glutamate pathways that are also really important for cognition and thinking skills. So as are the GABAergic pathways. So altogether, what this is showing is that when we have changes to these hormones, while we've always thought of them controlling our reproductive function, they do a lot in the brain, and particularly in brain areas and brain pathways that are really relevant to thinking skills and to mood. So we've talked about estrogen fluctuations and declines, potentially relating to brain function and potentially relating to cognitive impairment or brain fog type symptoms. But then we have often lots of other symptoms that we might experience during menopause. So sleep is often impaired during menopause. And one of those reasons is because of the hormone changes and that impact areas of our brain that regulate sleep. Or we might have hot flushes that disturb our sleep. So anyone at any point in your life, you know, when you don't sleep well, it's really hard to think clearly. So even if we took away the direct impact of hormones, just the impact of poor sleep on cognition is one other area as to why people might feel a bit foggy in their thinking. Then there's mood changes that commonly happen during perimenopause. So depression, anxiety, irritability, and depression on its own or anxiety on its own can be linked to cognitive changes. So that would be another factor. And hot flashes as well, that can come with a lot of stress. When people experience hot flashes, they can be quite frequent, and they can also on their own be related to changes in thinking skills. So there's lots of different reasons as to why someone might experience brain fog during perimenopause. Okay, so to finish with, probably the most important part, really practical part of what can I do about it? So for anyone who is experiencing brain fog, what can I do? So in terms of what we know and evidence-based for menopausal hormone therapy and specifically for cognition, we know that, or we think that menopausal hormone therapy may provide some protection against cognitive aging and Alzheimer's disease later in life, maybe, but this might only be the case for women who have a genetic risk for Alzheimer's. So the data and the meta-analyses that have been done are still unclear as to how hormone therapy relates to cognition right in the time of menopause and later in life. So perhaps there's this benefit for those women who are at genetic risk, but we don't really know. And the cognitive benefits, both in terms of later life cognition and in terms of the immediate experience of brain fog, probably or appear to depend on the age at which people start hormone therapy. So there's the timing hypothesis, which suggests that the use of hormone therapy, so estrogen particularly, in perimenopausal years or very close to the time of menopause might have a benefit. But it seems to be that later use, so depending on when people experience menopause, but later use doesn't seem to help cognition and may be harmful. And it's also unclear about the length of time that people use hormone therapy and whether that is or is not linked to later life cognitive decline. So we just don't have enough evidence, but it appears that, and anecdotally, a lot of women talk about taking hormone therapy and it helping their thinking skills. So it's always something you can try, and it certainly is helpful for people who have early surgical menopause, and it's particularly helpful for that group to reduce their risk of later life cognitive decline or later life dementia. So in terms of more practical tips, I think just for individuals or for other people that you know who are experiencing brain fog is just to reassure and normalize that experience, because most women, the literature is about 60 to 65% of women will experience brain fog at some point during those perimenopause. Differing degrees of severity, but it's pretty normal to experience brain fog. I think if someone's talking to you about the experience of brain fog, just taking the time to address those concerns and finding out, and for yourselves as well, thinking about, when does this happen? How does it impact my work and my life? Does it happen when I'm really stressed, or does it happen all the time? And just thinking about the when, and also validating that it is a real experience. People sometimes think I'm going crazy, what's going wrong with me? But just knowing that it's normal and it's a real experience, even if you do neuropsychological testing and all your performances are still within normal limits, that doesn't invalidate someone's day-to-day experience of brain fog. So it's very real for a lot of women. So getting a bit more practical, if someone has got difficulties with attention, so being able to focus on one thing, I think there was a question about focusing or multitasking as well. So just briefly, multitasking in terms of neuropsychologically, we don't really multitask. We're switching our attention rapidly between two different things. So when our mental load is a bit pressured, being able to quickly switch and maintain two trains of thoughts becomes even harder. So for people who feel like they used to be able to multitask and juggle lots of things in their head, my advice is always reduce that mental load and be kind to yourself. Just say, this is a phase of life where I really just need to do one thing at a time, and be mindful, like be focused on that one thing. And for everything else, you have to try and get it out of your head. So writing a list of things to do to reduce that mental load. And sometimes we're juggling all sorts of things like high-level work demands, family life things like children or elderly parents, things like I need to get milk, I need to get bread are popping into your head. So it's good to get all of that out of your head onto paper and just reduce how much you're juggling in your head so you can focus and actively attend to a task. If you find that your mind keeps wandering when you're trying to attend to your task, try different things to bring your attention actively back to that task. So it might be self-talk. So if it's, walking into a room, forgetting why, if that happens to you all the time, just self-talk. So I'm going into the kitchen to get my mug. I'm going to the kitchen. Now I'm here. I'm getting my mug. I need a cup of coffee or whatever it is. So just using self-talk to bring you back to the task at hand. If it's that you're reading something and your mind keeps wandering, you can highlight it. You can take notes. Taking notes is a really great way of helping focus on a task. And there is growing evidence for the benefits of mindfulness and meditation on our attention as well. So practicing mindfulness in whatever way works for you. It doesn't mean you have to meditate for 10 minutes every day, although some people do benefit from that. Being mindful is just about being present and engaging in your environment and your task. Meditation, again, this is another level of mindfulness. And again, there is evidence to show that the more mindful we are and the more we can, if you are someone who enjoys meditation, it can be helpful for enhancing your focus. So memory, there are external and internal strategies we can use. So external strategies are all the kind of scaffolding we can put in place to help our memory. So that might be things like having a really well-organized planner, either a paper planner or a app or a calendar on your phone or on your computer. So having somewhere to put everything in so you're not holding it in your mind. It can be using that to have reminders so you don't have to try and remember to do things. And you can also use your calendars to block out time to do a whole lot of things. So it could be a task that you need to do, finding times to do that. So you're not thinking, I've got to do that, I've got to do that, because I've locked it in for Thursday at 1 p.m. or something like that. Then there's internal strategies, which are when you need to learn a new piece of information. It might be using repetition, so repeating that to yourself a few times or reading something a few times. visualizing things. So you've got a visual imagery to go with something that you've read or something that you need to try and remember. So then, because the tip of the tongue is such a common phenomena during perimenopause, there are a few things you can do. So the best thing is to try and just talk around the word, to try and let go of that anxiety of finding that specific word, and instead use synonyms, or just try and talk about the topic, or own it and say, oh, I've lost that word, and then just describe what you mean. They're probably the best things to do. If you're writing a document, for example, and you actually need to find that word, then you can prompt yourself by using the starting sound. You can go through the alphabet by, at Burkert, like sounds that can help sometimes prompt what that word might be. Or you can Google similar words and see if that helps find the right word that you need. So just to finish up, I'm just going to talk about what evidence we have at the moment that shows that things that we can do during perimenopause to promote cognitive health. So I said earlier that menopause is considered a time of neurological transition. So the evidence to show that we can do during midlife to give ourselves the best chance of healthy aging and healthy cognition later in life. The first one is exercise. So there is so much evidence to show that exercise is helpful in the short term and in the long term. So it can be any type of exercise that you need. There are different theories about what your body actually needs from a physical health perspective, but from brain health, it's just exercising is really helpful. A healthy diet, not smoking, not drinking too much alcohol is also important. And the only probably consistently strong evidence is for a Mediterranean diet. So that's a diet that has lots of fresh fruits and vegetables, fish, and not processed foods. So that kind of diet, the Mediterranean diet specifically, it also has like nuts and legumes. That is the diet that stacks up as having the most evidence-based to promote cognitive health. Good sleep. So this is often easier to say and not always easy to achieve, but there are lots of things you can do to improve your sleep hygiene. Now, one of the most common distractors or impairments to sleep is using devices late at night. So trying to avoid that can be a small, sometimes challenging thing to do, but it can promote good sleep. We spoke a little bit about the potential benefits of hormone therapy. So at the moment, at least in Australia, it's not something that people can take specifically for cognition or brain fog, but it is something you should talk to your health practitioner about and see whether it's something that might be suitable for you to try. There is also a lot of evidence now for the benefits of being socially connected. So it's a good thing. It's a good excuse of why it's really important to spend meaningful time with friends and have social connections throughout your life, but particularly starting from midlife. And often when we're really busy, it's harder to prioritize social things, but it's important for your mental health and cognitive health as well. And the last thing is just stimulating your mind. And that doesn't mean doing crosswords if you hate crosswords. It just means engaging with things that use your mind. So most of people, particularly now, either work or read or have stimulating discussions, and that's really important to keep your mind active. So I think that was my last slide. So I might stop sharing and then I'm happy to answer any questions.
Thanks a lot, Dr. Caroline. It's been quite enriching to see this whole information put out there, because all of us are going through all these different stages. I've heard people go through it, but to understand the science, to realize that it's only parts of it during menopause that are affected. It's not like you're completely losing your memory, but it's just like the retention versus the just encoding, and those parts were, at least for me, it was quite enlightening. And also to understand the different parts of the brain and how much estrogen is there. I mean, we keep reading about that it affects your brain, but just to see it actually visually, it was nice.
My question is more about the, when you don't know it is brain fog during perimenopause, is nutritional deficiencies also something that patients come to you with, because there is a connection, right?
Absolutely. Yes, there can be lots of reasons why someone might have brain fog. Yeah, it could be nutrition. It could be hormone, like related to thyroid hormone abnormalities. There are lots of other reversible reasons why someone might have brain fog. So often someone would go to a general practitioner or a general physician first for blood tests to rule out anything that might be reversible. And if there's nothing that they can see, then they might come and see me for a more detailed assessment so I can have a look at what's happening to someone's thinking skills and their cognition after other factors have been ruled out. So yeah, but there could be lots of different things as to why someone feels like they've got brain fog. And as I said, sometimes it can be related to different mental health symptoms independent of menopause. That if someone has depression or anxiety, that can lead to brain fog as well, or memory problems as well.
Yeah, I think there's a question about cholesterol also. Is cholesterol in any way related to brain fog?
Yeah, it could be. I don't know whether high cholesterol on its own would have the same kind of presentation where it's sort of fluctuating in the same way that brain fog seems to fluctuate. But any kind of, there can be flow-on effects from any kind of nutritional deficiencies or exacerbations in your blood profiles that can have flow-on effects to other systems like brain fog.
Can it be that we also forgot about life events from the past? I used to have very good memory about them.
Yeah. So that's an interesting question. I think it depends. That's less common in menopause, that we would forget events from the past. So it just probably depends about how long ago those events were and whether they are somewhere sort of deep within your filing system in your brain and you can remember them if you're prompted, or see a photo and then the memories come back, or if it's just as if there's a complete blank and that period of your life just didn't happen. So that's less common. That from what I've seen during menopause and what I've read about, that there would be big chunks of time that just disappear. But we tend to see that more in people who have had trauma often, and people who have experienced periods of trauma do almost intentionally block out periods of time, and it's like they've big chunks of their life that they just have zero recollection for, but they've never really had a recollection for those periods of time. So it probably depends on what that exactly looks like.
Yeah, could it also be part of aging, that kind of some of that memory loss?
Yeah, that's actually a really good question because, unfortunately, as we age, we tend to have a little bit of memory loss, which is part of healthy aging. So the studies that have looked at longitudinal studies, which there aren't very many, that have looked at what happens to memory and cognition as we age, and then sort of tried to figure out how menopause fits into that in comparison to healthy aging and in comparison to males who don't have menopause. It seems to be that there's a little bit of a dip during menopause that seems to disappear, or bounce back again in those postmenopausal years in terms of memory. So that seems to be what the literature is. But there is also very normal, very healthy aging where we do have changes in things like memory and attention and how quickly we process information.
Thank you. Lovely presentation and very informative. Thank you so much. So my question is more from the perspective of, the use of technology to improve, so that we are not putting too much impact on our memory. Does that over a period of time actually make us more dependent? So, just is there any, intergenerational study? Because often I find, people in my parents' generation say that you don't remember phone numbers because you're too dependent on mobiles and it's already there. So just curious as to, the more you become dependent, does that memory deteriorate more in this menopausal period? So is there any balance that we need to look at?
Yeah, I think that's a great question. So my advice is always, and based on literature, to use compensatory strategies. And I think your parents' views are right. We don't remember phone numbers, but the phone numbers now are a lot longer. They didn't have mobile phones a generation ago, so they had shorter phone numbers that were easier to remember. Our mobile phone numbers, our average capacity to remember is like 7 bits of information or 7 digits. That's what we can kind of remember in a healthy functioning attention span. So in terms of that mobile phone example, I think mobile phone numbers are too long for us to remember anyway. So I think using technology to help remember things and help support our memory is a good thing. And you generally still use your memory a lot for all sorts of things in your life. So it's not like you're not using your memory. You're supporting your attention and your executive function, and you still have to use your memory to remember things, but it might be different things as our environment and our society changes. In terms of technology, though, there is literature emerging that using lots of smartphones which have like really short bits of, or, looking at TikToks or other social media things, there's lots of short attention spans, and that does have an impact long term, they think now, on how our attention works, which would have a flow-on effect to our memory, like how long we can focus for. So the advice is, don't use those kind of social media things a lot, because then we do get used to focusing for only very short periods of time. But in terms of using devices to help with structuring our lives and reducing our mental load, I think that is a positive thing to do. And yes, you would still be using your memory in lots of aspects of your life, even if you're using technology to support it.
Okay. Thank you so much.
Thank you. I mean, that's a great question. I had a question about the social media, if that's going to affect how that affects. So there are a few more questions from our group that I just have narrowed down, which are interesting. Does it peak in relation to menstrual cycle? So in perimenopause, is there any relation between the menstrual cycle and your brain fog?
So I think there is only for women who are really sensitive to hormone fluctuation. So for women who have something called premenstrual dysphoric disorder, so really quite severe premenstrual symptoms, so just before menses, one of those symptoms is changes to concentration, like a brain fog. So for those women, yes. For women who aren't that sensitive to cyclical fluctuations, there might be very subtle changes, but we're unlikely to notice them. So that's like normal menstrual cycle. But then in terms of menstrual cycle around the perimenopause, it's really hard because those fluctuations in estrogen levels are quite rapid, and people's cycles become not regular anymore. So it becomes harder to know exactly when when brain fog is being experienced. But the literature would suggest so far that it's more, some people are particularly sensitive to the fluctuations, so to that up and down of estrogen, and that's what's perhaps driving some of the mood symptoms as well as some of the cognitive symptoms.
Okay. There's one question, does it go away?
So there's not that many longitudinal studies, but most of them say that yes, it does. Things improve post-menopause. So, and in terms of the biology, the theory is that most brains adapt to reduced estrogen levels that our brains have, or reduced levels of the particular estrogen called estradiol. Most brains adapt post-menopause, so they're less likely to be affected. There is a couple of studies that have shown, like maybe 2 studies that have shown that people who are at high risk of Alzheimer's disease are less likely to adapt in terms of their brains to that lower level of estrogen. But that's really preliminary and we don't really know.
Okay. And one last question about work related. So I'm not able to focus with my work and struggle. How do I overcome this? So I'm going to just turn the question, when they're at work,
Yes.
is there some tips that you can give for that?
Yes. So within the workplace, I think the best things to do are, if someone, for example, some really basic things is get people to email you rather than shout out ideas. So if someone passes you in the corridor and says, oh, can you do this? Or meet me here, just tell them, oh, can you email me that? Or put that in an email. So it's written down. So again, you're reducing what you're trying to hold in your mind. Take notes and don't be ashamed of taking notes. So then again, you're writing things down and you're not trying to rely and pack your brain with bits of information. Sorry, I just didn't know what popped up on my screen. And
Oops,
I think
just 1 second.
somebody's sharing.
Oh yeah, sorry. Yeah.
Yeah, so they're probably the key things, I think, is just writing things down or getting people to write things down for you. Taking breaks, like going for a walk and stretching so you can have a mental break, fresh air, cup of tea, that kind of thing, just to take breaks so you're not trying to focus for really long periods of time. That's specifically for the brain fog type symptoms. If you're forgetting words, it's okay just to say, oh, I've forgotten that word, or I can't think of the word at the moment. Most people, if they're also similar age, will experience that too, so it's not a big deal. And if there are men in the room who don't experience that, even though they probably do from time to time, or bad luck.
Yeah. And lastly, I think I mean, I just want to say it's been super informative and super good. There were a couple of programs that we have on Miyara on this mental fitness, and I think that's about experiencing this new, just gaining those new experiences by doing these different
Yes.
crosswords or problems. And I think that's one of the ideas that you also mentioned. And the other thing about mindfulness, about just being aware of and accepting that you are going through this this one. So in fact, Dr. Gargi Chandalia, she has put these programs together. So she's who just asked a question. So I think these are the kind of programs also that you're talking about that can just help get through this life stage and get through brain fog. So it's great to know about these tips and tricks and how to help yourself pass the stage, and that it actually goes down that post-menopause you will find relief. So I think these are really good to know. Thanks a lot, and I hope it's clear for everybody why they're going through this and what they can do. And just love yourself, accept yourself, and we can get through this.
Absolutely.
So much.